Awesome, guys. Hey, happy Wednesday, October 28th. I am Dr. Jason Bradley, and this is Wellness Wednesday with yours truly. And today I'm going to be talking about a subject that is very near and dear to me. It affects approximately, boy, I did some math earlier, conservatively, I would say about 45 million Americans. Out of that 45 million, about 27 million don't even know that this affects them. That's a large swath of our adult population if we really get down to brass tacks. And I mean, it's literally about 12% of all Americans, and even larger percentage of adults. And here's what it is, guys. It is a low functioning thyroid gland. And I know that we hear a lot about hypothyroidism or low thyroid, and it's getting a lot more traction, so to speak. It's certainly getting a lot more lip service, at least on the front end of medicine. I'm starting to see doctors doing a little bit better job. Sorry, guys, I'm going to put my headphones in so we have better sound. Possibly. There we go. Maybe. Nope. That did not work. Hold on. Hold on. That was great. I'm going to just go off that and back to the camera mic. What was really great is I put my headphones in thinking I'd have a better connection with you guys. And instead what I heard was my feedback from Facebook. So I was actually listening to myself a few seconds ago, and it was really disorienting. But nonetheless, kind of jumping back in, we've got conservative about 45 million Americans, 27 million Americans that don't even know they have a thyroid problem, but they continue to suffer. And the reason that this hits me home is for so many levels. First of all, as you guys know, or maybe don't know, I have suffered from, for many years, Hashimoto's thyroiditis, so an autoimmune thyroid condition, if you will, an autoimmune condition that affects the thyroid, as well as having low functioning thyroid. And I've been, very fortunate to have a career and a focus in my career that's on the thyroid and on the endocrine system. And I've had the opportunity to work with thousands of folks from all over the world at this point with all sorts of thyroid conditions. And we've really been able to hammer out some specifics of how to take an autoimmune thyroid condition and get those autoimmune antibodies to go negative, how we can take a dysfunctional, thyroid pathway for those folks that still have an intact thyroid. We meet a lot of people, most people before the surgery. I know a lot of people are scheduled for thyroid surgeries. We'll get there in a minute. But, take that intact thyroid and make sure that we're supporting it in the right way so that it's functioning well, hopefully able to wean them off of medications or support, supplementation. And then last but not least, of course, I had a consultation with a client with this earlier today. We pick up some folks that are post thyroidectomies, post surgical and chemical ablations where the thyroid has been removed or destroyed radioactively. And, so then we're playing cleanup as far as the rest of the body goes. But here's the deal. The thyroid is very complex. So it hits me personally. It hits a large portion of my patient population. And it's a really complex system that we can't just say, hey, my doctor checked my thyroid, meaning that they did TSH, thyroid stimulating hormone, and it was normal, so my thyroid's normal, and that's not what's going on. The reality is there are so many mechanisms at play. The thyroid relates, directly to the immune system, to the adrenal glands, to sex hormones, to metabolism, to nutrient density, talking to brain chemistry. There's so much going on with thyroid hormone that it's impossible for us, I want to be really clear, doctors, I'm talking about us doctors, to say that it is not a thyroid unless we absolutely have definitive proof that it's not. And I want to walk you through this. The title of this episode is exactly what to do if you're suffering from thyroid symptoms and your doctor won't listen to you, right? So here's the situation. And I know that you guys, I know that you guys know this. I'm going to get to the right screen here in just a second, right? Maybe. I had a really good list here, but I'll have to do it from memory because I'm not finding what I'm looking for. So long story short, I wanted to get a list of like the most common thyroid symptoms just so I didn't leave anything off the table because I almost always forget them because there's so many, right? So here's the typical situation in our case, and we're not the first doctor group that people are walking into. Most of our clients have been, to other general practitioners, to endocrinologists. We live in the Midwest. So, here in the Midwest, we have the Mayo Clinic, the Cleveland Clinic, over in Ohio, Minnesota. We have where I live specifically, the UIHC, University of Iowa Hospitals and Clinics, which is the largest teaching hospital in the world. So, we are not for a lack or a shortage of doctors in this area, but for some reason, people keep coming to me saying, hey, I've got a thyroid problem. And even though I'm taking medication, I still don't feel well, right? So that's typically who I meet. The other group of people that I meet are, I feel strongly that I have a thyroid problem. My doctor tested it. They did TSH, maybe a T4, and said it was normal and I don't have that. Hey, Dr. Bradley, somebody said that if you tell me that I don't have a thyroid problem, I probably don't. Can you please look at my thyroid and tell me if I do or don't, right? So I get those people as well. And then I certainly get a bunch of people that have been diagnosed with Hashis. I heard that you guys know how to make my antibodies go negative so my thyroid's not being attacked. We do. We have a system for that, and it works, and we have objective evidence showing that with lab testing. But nonetheless, here's our typical patient, right? They're going into the doctor, and they're tired before their alarm even goes off in the morning, right? So they are already exhausted, right? So their alarm goes off. They can't believe it. They can't decide, have I been sleeping, for 10 solid hours and still feel like crap, or did I toss and turn all night up and down and I still feel like crap? But nonetheless, I'm not ready for this day. I'm already tired. My body already feels weak. I already can feel the heaviness of my brain and that brain fog. I can't think through that gunk. My body is sore. My muscles are sore. My joints are sore. I've got a mild headache or a migraine. That's the way I feel today. My GI is not feeling well. I have a lot of discomfort. I haven't pooped in 3 days. I can't seem to lose weight. In fact, I swear if I look at food cross-eyed, I end up gaining 5 pounds. It's been going on like this, for a decade. My libido is in the toilet. My husband tells me that I can't, I'm not even functional as a wife. I feel like a horrible mother. And I honest to God, don't know what to do. On top of that, my skin is dry. My hair is falling out. And, I'm cold all the time. What am I missing here? Right? I'm cold all the time, and I'm horribly anxious and horribly depressed. What the heck is wrong with me? Right? We hear this all of the time. And the reality is, of course, when we break that down, a lot of these folks go to their, I'm trying to be nice here. I'm guarding my words carefully. A lot of these female clients of ours, right? And we work primarily with women with this exact set of symptoms. And they go to their doctor and their general practitioner says, well, I don't see anything in your labs that's a problem, right? So, and then you say, hey, I did some research online and gosh, this sounds like a thyroid problem. It really, really does. And I have 400 other symptoms as well. Guys, I want you to know, just so that you know, thyroid hormone, an adequate amount is necessary for the activation of all cells, right? The thyroid hormone works on the nuclear receptor inside the cell and signals DNA, right? What cells have DNA that needs signaling by the thyroid? Every single cell in your body, from your hair cells to your big toe cells, with the exception of mature red blood cells that have given up their DNA to be recycled in your body, right? So a lack or an inadequate amount of thyroid hormone can affect every cell in your body. And if it can affect every cell and every tissue, of course, every symptom could be related to the thyroid. So when someone comes in with a classic set of thyroid symptoms, listen, I'm the first to get on board that sometimes it looks like a duck, smells like a duck, acts like a duck, flies like a duck, quacks like a duck, the whole thing. But then when we look at it, it ends up not being the thyroid. It's rare, but it does happen. In those cases, typically, there might be a conversion issue in the pathway. It's not the thyroid itself. Or maybe it's a supportive tissue like the adrenals or metabolism or some sex hormone issues, or maybe there's just a problem making energy in the body with the mitochondria, right? So there's a lot of other things that could be going on around the thyroid. But today we're talking about thyroid. So you go with that laundry list of symptoms, like I am sick and tired of feeling, sick and tired every single day, every single minute of my life. And you go to the doctor and they're like, well, I ran the labs and I know you say it's your thyroid, but I looked at the TSH and I looked at the T4 and they were normal. So I don't think it's your thyroid, right? Now, I want you guys to understand that TSH, while the standard of care is actually the lowest level of thyroid care that you can get. It's not even a thyroid hormone, it's a brain hormone. It comes from the pituitary. And it's the brain it's the brain reading the whole body and saying how much thyroid hormone, inactive hormone like T4, active hormone like T3, anti-thyroid hormone like reverse T3, how much is in the body, and should the brain tell the thyroid to make more or less thyroid hormone? So if you have a lot of that hormone in the body, whether it's active, inactive, or the anti-thyroid hormone, the brain's going to tell the thyroid, don't make so much. If you don't have very much of that combination, whether it's active, inactive, or again, the anti-thyroid hormone, reverse T3, the body's going to tell the thyroid to make more. So TSH, it can interpret the body, but it doesn't tell us anything about the active version, the inactive version, the anti-thyroid version, the free versus the bound. I mean, there's a lot of questions that we have. You know, is that thyroid hormone getting taken up into the cell to be used at that nuclear receptor? We have a lot of questions about that thyroid pathway that cannot be answered with TSH at all. All that TSH says is, again, out of all the different thyroid hormones in your body, the inactive version that doesn't do crap, the activated version that you want plenty of, or the anti-thyroid hormone, reverse T3, that shuts the whole thing down. TSH looks at all of that as one number, the brain does, and says, make more or less TSH, more or less thyroid hormone, right? So to really dig in, we have to jump in and look at that inactive version T4, look at the active version T3, look at the anti-thyroid hormone, reverse T3, and be able to understand where in the pathway, I mean, is it a thyroid problem? Somebody could have a normal TSH, right? A normal T4, inactive hormone, but a really low amount of the activated T3, and maybe a really high amount of the reverse T3, the anti-thyroid hormone that shuts the whole thing down, right? And if we're just looking at TSH, we don't know that. We would call it normal. And then you get those smart doctors looking at TSH and T4, the smart doctors, right? Well, the T4 is the inactive hormone. The situation I just described, normal TSH, so all of the hormones together are normal, right? A normal amount of T4, the inactive hormone, but a low amount of the active version of T3. So now the cells aren't working, and make it even worse, a high amount of the reverse T3 that's actually blocking the cells that want that T3 from even functioning and connecting with that T3. So what happens is the TSH could be interpreted as normal, the T4 is interpreted as normal, and then your doctor's like, it ain't your thyroid, right? So you guys already know this. If it's not your thyroid, right, and you're tired and you can't lose weight and you can't think straight and your body's in pain and, you know, something's wrong with me, but I don't know what it is, and I'm the doctor, right? This isn't me, but, you know, I'm pretending to be a different doctor because hopefully I'm listening to my patients. But, you know, I'm that doctor that's like, well, I looked at your TSH and your T4 and it looks completely normal to me. So it's not your thyroid, right? Because they didn't take it as far as they needed to. They always tell those patients, at least in my experience, hey, it's not my fault. I can't figure it out. I'm a doctor. I know everything. Clearly, this is your fault. You have a psychiatric problem. So here's some Zoloft, Paxil, Prozac, Wellbutrin, Effexor, et cetera, to help you with your psychiatric problem because it's not your thyroid. And I'll give you these drugs and hopefully they'll help you feeling okay with being unable to lose weight or having energy, not having enough energy, or feeling, you know, in pain and having no libido and all that kind of stuff. Maybe you'll feel okay about that and that'll boost your mood a little bit, right? And that's the way we handle this. I mean, how many women do we know that are, you know, denied even looking at the thyroid and are told that they have a psychological psychiatric problem that they need medicine for? It's 72% of adults in America. So about 3/4 of American women are told that something's wrong with them, right? That they need psychiatric help, right? And I think if 72% of our population needs psychiatric help, I mean, maybe we need to step back and say, what the heck is going on with our population? What's going on with our society? But that's another story for a different day, right? So here you are, here's another scenario. You go to your doctor and we all agree you have a thyroid problem, right? And they give you some levothyroxine or Synthroid, right? We were pulling up articles earlier today. There's a massive amount of publications on the people that are on levothyroxine, Synthroid, regular thyroid medication, right? They had a low functioning thyroid or they had Hashimoto's, and that's the way they're being treated. And they're very upset with their outcomes. They don't feel any better, right? But let's walk through that scenario. So here's someone that has, everybody agrees, doctor agrees, they finally checked the thyroid and the TSH was off or the T4 was off or both, right? And they're like, you could benefit from some thyroid meds. Here's some synthroid and levothyroxine, which is synthetic T4. Synthetic T4 is synthetic inactive thyroid hormone. Levothyroxine is left-spinning thyroxine, left-spinning T4, left-spinning inactive hormone. It has to be activated. I want to be very clear about that. Here we give you the medication, and what happens to the TSH? Well, it was running really high. Well, now we gave you this inactive T4 that builds up in your system. TSH comes down to normal. Here's the doctor being really smart, running your T4 levels. They look normal as well. You're still suffering from the thyroid symptoms. The labs now look okay, right? The labs were running, TSH and T4 look fine. Nobody's looked at the active T3. Nobody's looked at the reverse T3, right? So we still don't know what's going on with the pathway. What we find is about 85% of the time, this correlates well with the literature that's been documented on this. Again, patients being treated with levothyroxine, bringing their TSH into what we call euthyroid or normal thyroid status, but still exhibiting thyroid symptoms. The literature is rife with this, saying that we're not doing it right. And yet in general medicine, we keep giving you guys synthroid and levothyroxine, getting your TSH normalized and calling our job done. You're still suffering. And so therefore you have a psychological condition. That's as deep as the river runs with doctors, with most doctors. So again, the title of this is exactly what you need to do. Well, first of all, you need to educate yourself. I want you to understand the level of education that of doctors that are out there. They learn a lot. I mean, I have 4 doctorate degrees. I can't say I didn't learn a ton, but I'm going to quote one of my good friends, Dr. Stephen Ball, who said this as he was getting his first medical degree, right? He said that as he was walking across the stage, he felt the information dripping outside the back of his head, and like he was losing the knowledge that he had just paid $250,000 for over the previous 4 years, but at least he knew where to go look for it to remember it, right? I want you guys to know that health, science, chemistry, all of it, physiology, let alone the subfields. I mean, there's the depth of data that's there is so immense that it's going to be impossible for any provider, physician to know all of it, right? So we end up memorizing. I mean, this is what, hopefully some of us take it further than this, but we end up memorizing the bare minimums, right? And the bare minimum treatment for thyroid for everybody is order a TSH. If you want to be really savvy, order a TSH and a T4, right? Or a free T4, right? And that's as deep as it goes. And again, no one's looking at T3, free T3, reverse T3, T3 uptake, all these other pieces, let alone looking at things like, is this low functioning, what is this low functioning thyroid due to, right? So again, I want you guys to understand that the first thing that you need to do is educate yourself and understand, how do we even evaluate the thyroid, right? And I want you guys to know, again, doctors are taught to evaluate one thing and one thing only, and that's TSH. Savvy doctor might throw in a T4 or a free T4, but you really need, I'm going to give you the list again, at a bare minimum, TSH, total T4, free T4, total T3, free T3, reverse T3, T3 uptake, and then I would throw in thyroid peroxidase antibodies and antithyroid globulin antibodies, the 2 main thyroid antibodies, right, for looking for Hashimoto's. Because I would say at least 50%, if not more, of low functioning thyroid is going to be related to some immunological disturbance like Hashimoto's thyroiditis, right, and autoimmunity. So we haven't even gotten to what causes hypothyroidism. We're literally at this point just saying, educate yourself on what labs you need to get done. Educate yourself on that list of symptoms that I gave to you, right? Which was pretty straightforward. I can give you that again, but fatigue, depression, dry skin, weight gain, higher cholesterol, thin or coarse hair, losing hair, inability to focus, brain fog, low libido, so no sex drive, sluggishness in the morning. Again, you can barely get out of bed, sensitivity to cold, cold hands and feet, muscle pain, fluid retention, thinning eyebrows, right? The list goes on and on and on, right? Not to mention, even though you're exhausted, you still have sleeplessness. I mean, so now you're tired but wired. And I mean, I have lived through it from the male's end. I mean, I really my life crashed in 2004 because of Hashis and thyroid problems. It took me till 2007 to put my life back together. And then from 2007 till now, we've been doing nothing but honing in on how to quickly resolve this for other people, because I suffered enough. I don't want any of you guys suffering. I made a lot of mistakes, even with 4 doctorate degrees and 3 board certifications, and many years of experience with this. I made a lot of mistakes with thyroid and figured it out for me, and then now figured it out with thousands of clients. And this is what I'm trying to share with you guys now, is to let you know that there is hope and there is help. So listen, make a list of your symptoms. Here's exactly what you need to do. Make a list of your symptoms, right? If you make a list of the labs that you want done, I just gave them to you, right? If you forgot those, you can certainly reach out to the clinic, info@epicfnc.com. You can go to our website or social media. You can find us anywhere, right? Reach out to us. I'll tell you what that list is. And I'll tell you right now, again, TSH, total T4, free T4, total T3, free T3, reverse T3, T3 uptake, TPO antibodies and antithyroglobulin antibodies, right? Those are the tests at a minimum that we do. I think I said reverse T3, but that we do. So that would be 1, 2, 3, 4, 5, 6, 7, 8. That's 8 tests that we do at a minimum to evaluate the thyroid. And then we feel comfortable saying this is or is not a thyroid condition. The next questions that we have, of course, are what's causing that problem? Is it due to nutrient deficiency? Is it due to an enzyme problem? Is it due to the brain and the thyroid not talking well to each other? Is this due to other hormonal signaling issues? Is this due to an autoimmunity? Do we need to take care of the immune system? What an infection? The list goes on and on. Our question is not just what is the thyroid, what is it, or is it not a thyroid problem, or where exactly in the pathway is the problem, but why do we have it in the first place? And that's where we jump in to solve those problems, not just get people feeling better, but to resolve them from the front end. What are the root causes? What can we do to fix this problem now, right? So again, make your list of symptoms, make your list of labs, and quite frankly, I don't know how to say this without just saying it, demand that your doctor listen to you and order those labs. Now here's where it gets funny. Doctors don't like it when patients tell them what to do, because again, we're all trained as gods. We know everything. And who's this patient telling me to do my job? I know more than this patient does, right? Now, I don't think that way, but I know that you guys know what I'm talking about. You've been on can I say this, on the receiving end of those deaf ears? I don't know if that's the right way to say that, but I know that your words have fallen on deaf ears. I know that your doctors have not listened to you, because I talk to hundreds and hundreds and hundreds of you every year, that tell me the same stories over and over and over again. So you guys have to have a doctor that's open. If you guys feel like you have to convince your doctor, or God knows, if you feel like you're educating your doctor, and I mean this from the bottom of my heart, I would recommend finding a new doctor. I don't know at what point it became doctor here, patient here, do as I say, and don't question me. Doctor means teacher, okay? One who teaches, that's it. And docere from the Latin. Our job is to teach our clients how to be healthy. Sometimes that's sorting out medical problems, right? It's sorting out, maybe there is a named condition that we need a medicine for. Or maybe sometimes there is hey, you have a hypothyroidism due to fill in the blank, a dysfunctional immune system and too little iodine, right? Let's fix the immune system iodine so we fix the thyroid problem. In the meantime, here's some thyroid medication while we're fixing it, right? I mean, the doctor's job is not just to diagnose and medicate, right? Our job is to fix things, to teach our clients, docere, one who teaches his or her clients how to be healthy, right? That's our job, not medicated disease. So if your doctor is medicating the disease and you feel like you're convincing them that it's a thyroid problem, I can tell you that they're going to have no idea how to resolve it, right? So I want you to own that. This is a very complicated pathway. I've been studying it for, I've been in practice for 21 years, 21 years and 6 days, right? I had to do the math, right? So just this month, 21 years and now 6 days. And I have spent, not only that whole 21 years, but even the previous, I would say 4 to 6 years before that, understanding this thyroid pathway, right? So I've got myself over a quarter century into just understanding this one thing about the body and the way it relates to the immune system and the metabolism and the energy production and brain function and heart health and GI health and, all nutrition and the whole, that whole thing. I've got, boy, what is that? 25 years, I think, 25 years, a quarter century exactly in this project. And I'm going to let you guys know, I'm still learning. Every single day, I'm still diving deeper. You know, as a clinician, I feel like it's my job to be the best ologist of all the ologies, but especially the ology that I'm practicing within, which I guess would be thyroidology. I don't think that's a word, but I think that you guys get the idea, right? I've gone out of my way to understand that. So I want you guys to know that not, and I mean this out of love, not all doctors are created equally. You know, if you ask me to do surgery, I have a joke that I would tell you, and it goes something like this. I will totally do that. I'm sort of trained in sort of what to do. I'm going to need a bottle of whiskey and a butter knife, and I'm going to let you know in advance the whiskey's for me, right? And I'm teasing because I don't know how to, I mean, I could do it in a pinch. You know, if it was like the zombie apocalypse, I'm sure I could figure something out if somebody needed a surgery. But that's not my gig, right? My gig is thyroid. My gig is hashies. My gig is autoimmunity. And so I would want you guys to make sure, especially if you're suffering from thyroid, make sure you're, or God knows, hashies or autoimmunity, work with someone that's all they do. That's what you guys need to be doing, is find yourself a good team and find yourself a good doctor. So again, I'm going to go over exactly what you need to be doing. You need to make a list of your symptoms. And I hope you don't feel like you need to convince your doctor that they need to listen to you. Your doctor should know. If they don't know, find a new doctor. You should make a list of the labs that you want done. Your doctor should listen to you and understand why you want them done. And again, if you have to educate them or explain it to them or convince them, again, find yourself a new doctor, please. And then last but not least, make sure that you're working with the right team. If the team, the medical team that you're working with, does not have extensive experience specifically with thyroid and hashies, if they're just generalists, I'm going to tell you right now, they don't get it. They can't get it because they didn't have enough time or focus to put into it. And I'm not trying to pick on them. Again, there's a time and a place for everything and everyone that we do. But I am a big believer that we all deserve the very best healthcare, the very best team. I always say, you know, if I need a healthcare team, I'm not picking on anybody, but I'm not going to go to the Walmart version, right? I want to go to the Beverly Hills version. I want to go to the very best of the best of the best. Why would I ever accept less for my body or my family's body, right? We only get one shot at this. We get one shot at life, and that's it. Why would I ever entrust my body to anybody except the very best person in the world that's educated in what's going on with my body? And I'm going to let you guys now know that for our clients, that very best educated person in the world hopefully is our client, because we've educated them on what they need to know to be empowered to take control of their health and their happiness and their future, right? But you got to find a team that's going to do that with you. So again, I would say, again, the three things is exactly what to do. Make a list of your symptoms, make a list of the labs you want done, and make sure that you're working with the best of the best team. If you don't, I mean, and I think that you already know if your general practice person or your endo is the best of the best, right? If you're frustrated, you probably should look for somebody else, right? So here's how you're going to find somebody else. First of all, I'm just going to say, if you want to reach out to my team, you can go to info@epicfnc.com. And you're going to be connected directly with some of our team, and they can help answer those questions and redirect you to somebody either, you know, that we know within our network in your area, or even some telemedicine if that's appropriate, right? You can also go, and again, this is my humble opinion, go to functionalmedicine.org, ifm.org, so the Institute for Functional Medicine, right? ifm.org. You're going to want to look at find a provider and find someone that has the credentials IFMCP. These are people that are board certified in functional medicine. Now, within that IFMCP group, you're going to want to look for people that say, hey, I specialize in thyroid, hashies, you know, whatever it is, right? Or, hey, if you're looking for women's health, or if you're looking for men's health or whatever, you're going to find an IFMCP that specializes in that probably, right? And I would recommend that you work with those people, because in my opinion, and again, having 3 board certifications and 4 doctorate degrees, my IFMCP certification was the hardest board test I've ever taken ever in my life, ever. And I've taken a number, right? So believe me, those doctors are screened. There's only 1,307 of us. Maybe it's 1,360 now in the world. I think we had another set of graduates that went through. There's not very many of us in the world. But find an IFMCP, find one that specializes in thyroid, hashies, et cetera, and then work with that person if it feels right. You know, interview that person. A good doctor would be interviewing you as well to just see if it's a good fit. If it's a good fit, run with it. If it's not a good fit, there's probably some options there. So again, we're happy to help you find that person. We're happy to chat with you about telemedicine. We're also happy to help you guys find someone in your local area. Go to ifm.org, functionalmedicine.org. Email us, info@epicfmc.com. We're happy to help out. And again, I don't want any of you guys to be in that 27 million adult American group, 27 million adult Americans that are having low functioning thyroid that are just not being diagnosed. And that's from the Thyroid Society, right? So, I mean, these are just real numbers that we're all working from. 45 million estimated in America. That's 12% of Americans. 60% of those undiagnosed, 27 million Americans that continue to suffer for absolutely no reason other than the fact that they just don't have a doctor that's listening to them, that's willing to dive in, get the work done, and help them step by step along the way. So I hope that was helpful for you guys today. Of course, if you found this helpful, share this video, subscribe to our YouTube channel if you're catching this on YouTube. Join our Facebook group, the Epic 5 Plan Community. It's our free community that's online. We share a lot of information. I do weekly coaching in there. So do my coaches. We have challenges. In fact, I think we just finished a detox challenge, and in November, we're doing a movement challenge, and it's going to be a lot of fun. I was chatting with Dan, our lead health coach, this morning, and he's got some really cool ideas. And he and I will be jumping on for an hour a day for an entire week, I think in a couple of weeks, just talking about movement, the way it affects the body. So check out the Epic 5 Plan community. It's free to join. Hopefully tons of valuable content there. Invite your friends and your family member to join that community. The more, the merrier. We started that community early in the year. My goal was to get it to 1,000 members by the end of the year. I think we're at the mid 700s, and we've got a month and a half to go. I think we can do it. So join the community, invite your friends, and let's just make that a really healthy, vibrant, healing community. I love that. So I'll see you guys next week. We're going to take this a little bit further and start talking about, not only what to do if you're suffering, but also what causes thyroid dysfunction, what causes thyroid autoimmunity. And we're just going to keep diving deeper and deeper and deeper into this. I'll be sharing with you. I'll be having friends of mine coming onto the show, sharing their techniques and their perspectives. And I'm just, like I said, thanks for joining today. I'm honored to be here with you guys. I'm honored to share with you my 21 clinical years, 25 research years on thyroid, hashes, and all things health related. If you ever have any questions, email them to info@epicfmc.com. I'll cover them on a show. I love you guys. Stay safe, stay healthy, stay happy. Bye-bye.